Hi, my name is Rene and I'm a physiotherapist based at the James Paget Hospital in Norfolk. I will be giving you a brief overview of our quality improvement project, the Orthopaedic Out of Bed project, and how we use the National Hip Fracture Database to improve our patient outcomes. I would suggest watching the video by Joshua Bannister below on how to get the most out of using the National Hip Fracture Database for your own projects and your own trust data. I will start with the challenge that we faced at our own trust back in 2019 in relation to the NHFD key performance indicator for prompt mobilisation following hip fracture surgery. The national average was 81%, as can be seen on the red line going horizontally, and the James Paget Hospital was underperforming on this KPI with an average of 60% versus the national average of 81%, mobilising out of bed by the day after surgery, and that is indicated by the vertical blue line to the left. It was important for us to improve this as the benefits include reducing acute length of stay and reducing mortality in this patient group. One challenge that we faced was that the literature was suggesting that early mobilisation after hip fracture surgery is seen as a single profession task, and this is specifically seen as the role of the physiotherapist. However, the CSP hip fracture standard state that all patients should be mobilised on the day of or the day following hip fracture surgery, but they do not specify that this needs to be completed by a registered physiotherapist. This was the basis for our quality improvement programme. We engaged our key stakeholders, including our lead consultant, divisional manager, matron, ward sister, and healthcare assistants, in order to identify what were the main issues to overcome and to help generate ideas to improve the situation. One idea was to empower and better utilise the healthcare assistants who were already doing a great job in other aspects of the trauma patient care, but who felt either unable or uncertain about attempting prompt mobilisation. We developed a training program to increase healthcare assistant confidence and competence in relation to identifying those patients who were safe and suitable to mobilise prior to physiotherapy assessment, or identify barriers with a reversible cause to make mobilisation at a later time more likely to succeed. For example, noticing a patient is in pain during their wash and highlighting this to the nurse who may be unaware of the level of pain that the patient was in. The aim of this training was to allow the opportunity for some patients to be able to mobilise out of bed prior to physiotherapy assessment, which then allowed the physiotherapy assessment to focus more on rehabilitation and early discharge planning, or B, those who struggle to mobilise or who have clear barriers to mobilising, such as pain or hypertension, to have the opportunity to overcome these barriers earlier in the day and increase the chance of successful mobilisation later in the day. The theoretical component of the training, which was delivered on a 2-to-1 ratio, with one physiotherapist delivering the training to 2 healthcare assistants in an area away from the main ward and for approximately 45 minutes, was followed up with a planned observation of the healthcare assistant mobilising a patient for the first time before being signed off. Our outcome measures were the percentage of patients mobilised by the day after their surgery and the percentage of these patients mobilised by a healthcare assistant prior to physiotherapy assessment. We consistently achieved around 20% less than the national average for prompt mobilisation following surgery in the 3 years leading up to our quality improvement project. We were pleased to demonstrate that over the 3 years since we've been providing yearly out-of-bed training on the trauma ward, that we have improved our percentage from 70% in 2021 to 79% in 2022, over 80% in 2023, and this year averaging around 90% mobilised out of bed by the day after surgery. Importantly, we were also able to demonstrate that the percentage of patients mobilised by healthcare assistants increased significantly from less than 2% before starting the out-of-bed project to 30% in 2022. This has massively empowered our healthcare assistants and also has meant that physiotherapists can focus more of their time with the 70% who are not able to mobilise with our healthcare assistants and increase the time available to provide rehabilitation in the acute phase of recovery. Thank you for taking the time to listen to me today, and if you're interested to know more about the Out of Bed project, then you can find our paper using the QR code on this slide. Thank you.